3 years ago, Heather Payne was a career travel nurse, but while between jobs and insurance, she suffered a debilitating stroke while at home in Dalton, Georgia.
My doctors wanted me to see a lot of specialists. That's expensive.
The 53-year-old says the medical bills racked up, quickly exhausting her savings and sending her into medical debt. Then, in 2023, Georgia implemented the Pathways to Coverage program, which expanded eligibility for Medicaid, but attached work requirements too.
They said that I wouldn't qualify. I didn't make any money, and I wasn't able to work. I was too sick at the time.
Like the new national work requirements, Georgia's Pathways program adds steps and paperwork for people seeking Medicaid, allowing flexibility in determining what qualifies as work, as well as some exemptions. So Payne started taking classes, but learned she was still not taking enough credits to qualify for health care coverage.
Instead of taking Medicaid away or denying it to someone like Heather because they're having trouble checking all the right boxes, we ought to be using coverage as a way of helping people get healthy and improve themselves.
Ben Summers, a Harvard professor, says Georgia's program created so many paperwork challenges that it prevented people from getting coverage who would otherwise qualify.
Might what we saw out of Georgia be forecasting what's to come in the rest of the nation?
I think there's a real fear that what we saw in Georgia is going to be the same that plays out nationally.
The state of Georgia initially estimated roughly 50,000 residents would have access to Medicaid through Pathways. Today, just about 9,200 people are covered. And then there's cost. In Georgia, upgrading the verification system for work requirements cost more than $50 million. Just 4 times that, $200 million, has been allocated for the national rollout of similar work requirements. Some health policy leaders say that amount of funding alone could lead to a very rocky rollout. In a statement to NBC News, a Centers for Medicare and Medicaid Services spokesperson said in part it's committed to implementing the policies on time, consistent with the administration's focus on promoting self-sufficiency and preserving the program for the most vulnerable, adding that the agency will be monitoring states for compliance and will provide support to ensure eligible individuals remain enrolled and those no longer eligible do not continue to receive services. While Heather Payne finally has insurance through her school, she says the lapses in care caused permanent damage to her health.
It should be obvious from hearing my story that I want to work, and I needed temporary help that I couldn't get.
The national work requirements are slated to take effect at the start of 2027, giving states just a year and a half to build out their verification systems. And back to that point of cost, a new government report shows the state of Georgia spent $54 million in administrative spending versus just $26.1 million on health care spending from 2021 through mid-2025. That said, Georgia's program continues, the state asking the federal government if it could simplify some pieces of its program moving forward. Last week, the federal government approved that request.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.